Hello, I'm Solomay Tibabu. Welcome to the Going Digital Behavioral Health Tech Summit. I'm so excited to have Cara McNulty here with us. Cara, please introduce yourself briefly and your role at Aetna.
Thanks for having me, Salome. My name is Cara McNulty, and I am president of Aetna Behavioral Health and Resources for Living. Resources for Living is a service that we provide that addresses social determinants, work-life support, crisis management, as well as employee assistance programs.
Great. So, what is it exactly that brought you into the behavioral health space?
Oh, such a good question. So I'm a population health scientist by background, and I am passionate about reducing health disparities. And when you think about health disparities, what's at the center often is a mental health, either primary issue or secondary. Something else has caused there to be mental health disruption or illness or need for support. And I am passionate about finding ways to improve access, to be creative in our delivery, and to really reduce disparities as we advance in this field of mental health and total well-being.
So, we talked a year ago, and we've had an entire year of a pandemic since then. What have you seen in terms of changes with your members and COVID and mental health in general?
Yeah, so I mean, when we look at the impact that COVID has had on the country, I think we can all say it's tremendous and it has impacted everyone. When you think about the mental health impacts, it's profound. So right now, 51 million people in the United States have a mental health issue. We also know that 51 million is an underreported number. We have 24 million people who are seeking support for substance use or opioid use disorder. This past June, the CDC came out with a report that 1 in 4 18 to 24-year-olds thought about self-harm during the pandemic. And if you think about us as individuals going from being socially connected, interactive, whether that's work or in our communities or with our families, and then having the need to socially distance, what we've seen is increased isolation, loneliness, suicide, self-medicating behaviors like I talked about, as well as issues that are affecting families in itself, increase in domestic violence, increase in job loss, need for support regarding local food banks, increase in need for legal services. So the impact is profound. And the other thing that's really important is it's across the population, whether you're it's children or adolescents or young adults or families or elderly. It's across the population and across ethnicities.
Yes, absolutely. But on the bright side, Aetna's had some really exciting programs that I'd love to learn more about. So, why don't we start with this juicy new announcement around the mental health pilots with the CVS Health Hubs? Can you share more?
Oh, sure. And you're so right. You know, I'm a believer that with breakdown can come breakthrough. And that's what we're doing as CVS Health Aetna is breaking through a system, a delivery system, a care system that's from the 1800s and saying, how do we provide access, affordability, a service that reduces stigma and helps people not have to be an expert in mental health to get the care and support they need. So we are piloting and shortly we'll be in 34 Minute Clinic Health Hub locations in 4 states. We are piloting mental health services. So we have placed licensed clinical social workers in our health hubs, and they are there to provide support, assessments, brief counseling sessions, and resources. And those resources could be, Salome, maybe that individual needs to have some brief counseling and they might come back and see that licensed clinical social worker. It might be that they have, from that assessment, a higher acuity, a higher need for, let's say, psychiatric support. And so we've created relationships with provider care systems around our health hub Minute Clinic locations. And we're doing resource transfer. So we're getting people in to see the appropriate resource in a timely manner. And then the other thing that we're doing is you can come into this resource numerous ways. You could walk into one of these locations and say, I know that there's a licensed clinical social worker here. I'd like to talk to someone. You could be seen in the Minute Clinic and be screened for depression, and the nurse practitioner might ask you or will ask you, would you like to see a licensed clinical social worker? We have one right here on staff who can help you. You might be picking up a new prescription and the pharmacist can say, do you know we have licensed clinical social workers here? So there's a lot of different ways you can come in. The other thing these licensed clinical social workers do is they help you look at what are the resources that are available in that community, how to best utilize your healthcare benefits. But if you don't have healthcare benefits, what is available that you can have access to immediately so that people don't go without care? So it's really taking the confusion, the unknown, the scariness out of trying to navigate or asking for help and really making it easy.
That's just totally game changing. How exciting. Can't wait to see how that evolves and grows. Something you mentioned earlier is the impact on youth. I'd love to hear more about the Here For You program, if you can share more.
Sure. So, we really have worked hard to look at how is COVID and beyond COVID impacting populations that are at high risk. And if you just think about that stat I shared, 1 in 4 18 to 24-year-old has thought about self-harm. We can't rest knowing that. So we looked at how do young adults like to engage? How can we be creative? And what can we do to bring a support and opportunity to them without barrier, without hassle? So we started what we're calling Here For You. And Here For You is group virtual counseling session with a licensed clinician who leads the group. And I'll give the example for young adults. Young adults sign up. We have opened it up to anyone across the United States. They sign up, they can turn their camera on. They don't have to turn their camera on. And our clinician leads a discussion that is addressing what is pertinent to that 18 to 24-year-old population. And I think what often we forget is, through this pandemic, people have experienced a ton of loss of life, loss of jobs, loss of opportunity. Our young adults have also experienced great loss, and we might call them micro losses. You didn't get to go to college. You didn't get that new job because they couldn't hire. You don't get to see your friends. Maybe you didn't get to go, for those younger individuals, to prom, or you didn't get to go on a family trip. All those losses add up, and those micro losses impact an individual, especially those 18 to 24-year-olds, so much. And so these sessions really allow these young adults to come in and say, hey, here's what I'm struggling with, or gosh, here's what I've done to help me not feel so disconnected or lonely. We've done these sessions open to 18 to 24-year-olds. We've done sessions that focus on that same population, but for the Black community. We've done it for LGBTQ. We're, for Mental Health Month in May, we're opening it up to moms, women, and caregivers, because they're a population that has been impacted tremendously. We've done a few general sessions for anyone. And what you see in our results is, one, very high engagement. Two, our pre and post surveys show people feel not alone. They know how to access resources. We hear sentiment about, I found a new friend, I have been engaging with this person, but they find people like them. And what we know is we don't want anyone to feel alone or helpless or hopeless. And so that's what these sessions are doing. And it really democratizes the conversation and removes stigma.
What a great solution at a time when so many youth are suffering. Um, Speaking of which, one trend that unfortunately doesn't appear to be decreasing is suicide. And it sounds like Aetna might be doing some work around this area too. Can you share more?
We are, and I am so proud of CVS Health Aetna for the work and the commitment we've made. So we have taken a bold stand. We look at suicide as most often preventable. And so in walking our own walk, we have made a commitment to reduce suicide 20% by 2025 in our Aetna membership. And I mean, it's a bold statement, but we know we can get there. And when you think about what we're doing, we are embedding the safety nets that help us with predictive modeling. So how do we know when someone is trending towards self-harm? How can we take action? So you have that predictive modeling, but then we're putting in screening in our care management initiatives, in our call centers to do basic screening. So you're casting that net wide, because those couple of questions, PHQ-2, really help to get a quick snapshot on how someone is doing. We are partnering with providers because we ask providers, how do you feel about providing and supporting your patients that are suicidal? And some are very, very comfortable, and others are like, I need more help. So we're working with provider organizations to increase their knowledge and awareness of resources, as well as to create a specific network where we have experts in suicidality that we can partner with, that we can direct our members to. And we really are wrapping that network with tools and support that they need. And then we're doing something really unique, and that is anyone who has had an attempt of suicide. There is unbelievable research behind this initiative, and it's called Caring Postcards. And we're deploying caring postcards, and they're very simple. They don't talk about self-harm. They don't talk about health. They talk about hope and positivity. These caring postcards have been used all over the world. And what it does, it's a gentle reminder that people aren't alone. So we've deployed the caring postcards, and it's been extremely successful. And we'll continue to do those types of engagements. And the last piece that we've done in this whole policy systems and comprehensive approach is we have partnered with numerous community groups to continue to raise awareness, to partner in advancing suicide prevention and trainings throughout our organization and with our members, and also to ensure we're providing the support needed in communities that have the highest rates of disparity. So it's really exciting work. It's a bold goal, and I am absolutely confident we can achieve that goal and go beyond.
All of these initiatives are so remarkable. I'm curious, how do you think the delivery system, telehealth, and technology in general will evolve or not as a result of the pandemic?
Oh, one of the things I'm so excited about is the pandemic forced us to be creative, to be innovative, and to utilize technology as a society. So I just take our own use of telemedicine, telemental health in with our Aetna members. And prior to the pandemic, we had about 1% utilization. Pandemic happens, we spike up to over 60%. Now you might say, well, that makes sense. You know, we had to socially isolate. But what's interesting, Solome, is that now as things open up, we see for other parts of the healthcare system, people wanting to go in person. And absolutely, people want to seek mental health services in person. But we continue to see our telemental health and televideo services at over 60% utilization. It hasn't dropped. And in physical health, that telehealth option has dropped. And when you dig into it, what we're seeing is that people feel, one, it's convenient. It's convenient. Two, they feel less encumbered as they share with the provider how they're doing, how they're really feeling. And, you know, we've heard from many different groups of our members. Some of them just think it's easier. It's easier for me to be honest. It's easier for me to be direct. It also offers just flexibility, and not only flexibility for the consumer, but also the provider. So I'm so excited about telehealth, telemedicine, and where that's going as we think about mental health and mental well-being. The other thing that is, I would say, that we're leaning into as not just a result of the pandemic, but as CVS Health Aetna, is how we use technology in a member-centric way so that we are meeting the consumer, we are meeting the community where they're at. And that means, like I shared with some of our initiatives, Here For You program, it means you're customizing. You're saying, what's the issue and how do we make sure that we're meeting people where they're at? And so we're using technology, again, whether that is AI and how we're identifying members who are at risk, whether it's Here For You groups and we're using virtual and peer support platforms, whether that is app-based initiatives that provide, you know, CBT or meditation. We're using technology in a way that allows the individual to drive what they want, when they want, and how they want it. And that's a best possible outcome, because then we can get people the care and support they need instead of waiting until things are far out of reach.
Amazing. How great. It's so important to personalize care, and through all of these new initiatives, certainly it sounds like you're doing that. And thanks so much for talking about all of the exciting projects within CVS Health Aetna. As always, I wish we had more time, but thank you so much, Cara, for sharing your insights and all of the latest.
Oh, it's just a pleasure to be here. It's a pleasure to have a conversation with you again. And, you know, I would just, if I could, I'd like to close with this, that the part about my job that I find so hard is when people say, oh, I wish I would have reached out for help sooner, or I wish I wish I would have felt comfortable. I wish. And my hope is to anybody who is watching or listening is that you don't have to hope. You don't have to suffer in silence, and you're not alone. And whether that is reaching out to someone like me, CVS Health, Aetna in general, a local community resource, I hope that people remember that you're not alone and there is help and support. And so thank you, Solome. It's an honor to be with you.
Thanks so much. Really important message as so many people struggle throughout this year. Always a pleasure. Thank you so much, Cara. Have a good one.
Thank you. You too.